Despite Zambia committing to global tobacco control efforts by signing the World Health Organization Framework Convention on Tobacco Control in 2008, the country has yet to enforce key regulations to protect its citizens. Cigarettes continue to be sold cheaply, widely available, and aggressively marketed, even to young children. This has raised serious concerns among health professionals. Professor Faston Goma, Executive Director of the Center for Primary Care Research, says Zambia urgently needs a law prohibiting smoking in public places to reduce second-hand smoke exposure. He warns that the lack of regulation leaves thousands vulnerable to tobacco-related diseases.
Okay, those people who sell tobacco, can they, or those people who work in tobacco manufacturing, or can they work in better factories? The answer is yes. Okay, tobacco growers. Now, tobacco growers, if you talk to real tobacco growers, 75% of them want to change from growing tobacco to growing other crops. Okay, that is why I was amused with that gentleman from Rodazi, the one who was talking about farming in Rodazi, make so much money and what. Yes, some of them do make money, but most of them don't. Okay? So last time we were in Lumezi, in Lundazi, in Shipangali, then in Mkushi and in Keyema. Okay? We talked to the farmers there. 75% of them want to stop growing tobacco. They would rather grow other things which can bring them more money.
The Tobacco Control Consortium of Zambia chairperson Albert Piri is urging lawmakers to resist pressure from the tobacco industry and pass the long-awaited Tobacco Products Control Bill.
Will collapse the economy and eliminate the tobacco industry. That is not true. That is a falsehood. We have examples from many jurisdictions where there's tobacco legislation, where there are stringent tobacco policies in place. Let's begin first of all with, for example, Australia. Just very quickly, in Australia, despite having some of the world's toughest tobacco control laws, including plain packaging and strict advertising restrictions, BAT, British American Tobacco, still continues to thrive in Australia. Plain packaging, we're talking about just plain here, nothing at all. And they continue to thrive. The same applies to Canada. They have the same thing, plain packaging. Singapore, they have plain packaging. Uruguay, they have plain packaging. And Brazil, they will say, maybe Mr. Piri, you're just talking about the Wazungus and so on and so forth.
And there is growing political will to act. The Parliamentary Health Committee chairperson, Dr. Christopher Kalila, has pledged support for the bill once it reaches Parliament.
It is the right thing to do to protect public health, and that in fact it is a right of each and every one of us, the right to health. And so, as members of Parliament, particularly in the forum, sometimes we get surprised at what is happening. Ourselves, we are waiting very eagerly for this piece of law to come. As a forum, we have had sufficient engagements, I think, for so many years actually. All it requires now is for us to receive this piece of law and support it. However, there has been a protracted delay back and forth, which we don't understand. I mean, even listening to Professor Bowman's presentation this morning, when we look at those 6 interventions, they're very good. I mean, there's nothing there to suggest that we are going to stifle tobacco production in this country and therefore hide off some of the economic gains which are perceived to come from tobacco. There's nothing there.
As the pressure mounts, all eyes are now on lawmakers to take decision action. Will Zambia finally enforce tobacco control measures to protect public health? That remains to be seen. Malangi Nzombola, Liberation News, Lusaka.